It will help to regeneration of cells as well as uh, increase performance of the cells. Number two is hydration. The patient might exhibit with vomiting. Vomiting will result into electrolyte imbalance. So we need to make sure that we rehydrate the patient so that the vomiting, the electrolyte balance is not compromising. In addition to that, we need to manage pain. We said already that the patient might experience some pains, neck stiffness, and other things. So pain in the areas or in the area like the limbs, the hairs must be given, because this patient might experience some pains in the limbs. As such, pain management, we can prescribe drugs that can be able to relieve pain. But when you are giving drugs that may need to relieve pain, it depends on the severity of the pain. So every pain has got its measurement in terms of prescription of painkillers. Physical therapy, very important, because this disease paralyzes the body parts. As such, physical therapy, like physiotherapy, is very important because it helps to stretch the body. It helps to align the limbs or an affected area. So it is very important that we need to observe or to send this kind of guys to physiotherapy. In this case, rehabilitation area, whereby those kind of things can be done so that we can align again their paralyzed parts. Respiratory support, whereby you have got the weakness in terms of respiratory muscles. We need to put ventilators to this kind of patients so that they can help, so that they will be able to breathe properly. Because failing to breathe is a part and parcel of death, so we don't want to have this patient to be just dying. Ventilators will help to rectify this kind of things. So those are some of the management that are being put in place in terms of treatment. So as a disease, in terms of treatment, yes.
Now, complications. Now, what are the complications that can be raised by polio?
Polio has got a lot of complications. As I said, that this disease is very fatal. Number one complication is paralysis. Can be partial or total. Total shall mean all the whole attacked part will no longer be working. It has got paralyzed forever and ever. When it is partial, it might have some passive movements, or the range of motion will just have been reduced a bit. So in that kind of area, we say the partial paralysis. Respiratory failure, we said that this disease makes the muscle look so weak, and the stiffness might be there. So if the respiratory muscles are weak, so it will be very difficult for the respiratory system to be functioning, resulting into nothing but respiratory failure will follow, because the muscles of the respiratory system has been weakened. Cardiac problem will become because if it attacks the heart, that means the cardiac muscle will become weak and paralyzed. As such, this person might not will experience cardiac problems. So it is very important to observe the things critically, because those things are some of the complications in terms of poliomyelitis. In addition to that, we have got the post-polio syndrome, which is a long-term effect. These syndromes can be mental disturbance. You fail to think the way you were initially because, for example, if you suffered bubbler polio where it attacks the brain stem, that means your thinking capacity will be diminished. So those are part and parcel of post-polio syndrome. You can have leg paralysis, whereby your legs will no longer stretch again. Your limbs will never be stretching again. Even in the arms, although the arms and the legs, we classify them as both in the limbs. So you can find the post-polio syndrome, can be cardiac syndrome, can be even facial one. All those kind of post-polio effect might be exhibited by this kind of individual. So those are some of the complications. So polio is a very, very difficult infection.
All right, I can see the time is not on our side. Now, let's talk of prevention now.
This condition is very preventable, but most of the time it becomes very difficult for people to comply with those kind of methods that are put in place. As I was saying that this disease is a viral infection. That means it has got no medication, but it's a supportive management. So prevention is better than cure in this kind of infection. Number one, prevention is through vaccination. This vaccine is given to every born child at a certain age, and it is given on 4 doses, as polio 0, polio 1, polio 2, and polio 3. 4 doses in different doses. So those vaccines, they help to control the occurrence of this disease to our kids. And so doing, it is very important that we vaccinate them. We take them for vaccination. We don't need to be so reluctant on this kind of vaccination. Inactivated poliovirus vaccine. Another prevention is we need to inactivate polio vaccine. What is to inactivate? We need to make sure that those polio must be have a chance of giving the booster vaccine. That will help us to inactivate the polio vaccine. So it is very important the IPV method should be followed. Number 3 is good hygiene practices. This is a very key important point as well in as far as poliomyelitis is concerned, because we said it is caused by fecal oral matter and contamination of foods, even water. So whatever we are doing, our hygiene practices must exhibit or must be well observed, like hand washing. We need to have clean water. We need to have a good cooking practices. We need to have all those necessary matters in as far hygiene practices are concerned should be put in place so that we prevent this kind of poliomyelitis to attacking us. As well, improved sanitation. Sanitation, we are talking of both water as well as the toilets. We need to use toilets effectively so that we prevent having those kind of fecal matter everywhere, which will harbor or will invite the vector like excessive fly, which carries those kind of fecal matters. If it happens that those fecal matters contain poliomyelitis, likely we are going to catch it by contamination or by it fecally, or when it lands on our mouth and we take it. You never know what happens. So those are things that we need to make sure that we put them in line so that we prevent the occurrence of this poliomyelitis. In general, we can say that the WHO is doing its effort in terms of eradicating this disease, and there are a lot of organizations like Center for Disease Control, UNICEF, Rotary International, and the Global Polio Eradication Initiative. So those are the areas again that they are putting us again online in line with our prevention efforts. All these organizations, They are trying to help us so that we prevent this kind of infection. In summary, that's what I can say about poliomyelitis.
All right, thank you, Mr. Josam, for giving us a chance again to teach us, to let us know about polio. Listeners, that's all we had in today's program. Let's be together again on Health Issues Podcast on our next episode, whereby we'll be talking on another medical condition. You were with me, Liviness Mchoka, the producer and the editor of this program, and our guest as usual, Mr. Gift Josam. Let's meet again on the next episode.